Hello, today's question is over postpartum diastasis recti. Our question is, a patient who had a vaginal birth without complications presents to you in the clinic. The birth was 3 months ago and she presents with a 3 centimeter diastasis recti with 3 minus out of 5 or fair minus abdominal strength. What exercise is the most appropriate to start patient with at first visit? So we have A, straight leg raise, B, partial sit-ups, C, head lift, or D, lower trunk rotation. So, what is diastasis recti? Well, postpartum anyways, is stretching of the linea alba horizontally, creating a gap between medial sides of the rectus abdominis muscle. This can happen at various points of the rectus abdominis muscle, and to diagnose it, greater than 2 centimeters is used today, but still some use the less accurate 2-finger method. Diastasis recti can also happen in infants, obese people, and elderly people. And it's key to remember that abdominals play a key role in diaphragmatic breathing, as well as posture and stabilization. Straight leg raise. Now, this one is a bit of a harder exercise because you have to support the leg, and you also have a long lever arm with how far that leg is out. The longer the lever arm, the more weight there's going to feel like is on the end of the leg. And so you're actually working those abdominal muscles pretty hard, so it's going to be pretty strenuous. Partial sit-ups. You're going through full range of motion, which is good. However, that's going to put a lot of stress when the patient has poor activation of those abdominals. A head lift. A head lift is going to promote activation of abdominals, and there's going to be little stress on the abdominis recti. You don't have a long lever arm like your whole upper body torso or your whole lower extremity. Then you have lower trunk rotations, which are used for a lot of people. However, that's not going to activate the abdominis recti. That is going to activate the oblique muscles, which in return could actually cause some slight separation. And it's not going to bring those abdominal muscles together. So back to the question. First of all, let's pick this thing apart. So we know it was 3 months ago. We know she has a 3 centimeter gap. And we know her strength is a 3 minus or fair minus. So when thinking about that, we know they're not a 4 or 5, and we know they're just below a 3, which is fair. And so they're starting midway point. We also want to know what's most appropriate to start the patient with. Well, as we talked about, if they're starting off right around fair, a straight leg raise is going to be quite a bit to jump into. And then partial sit-ups, although that seems easy, it is going to be pretty hard for someone who is struggling to use their abdominals against gravity. A head lift is going to activate those muscles, but it's not going to put a lot of stress on those abdominal muscles. It's just kind of getting them activated. In fact, if you try this on the floor, you'll feel, if you have your hands on your stomach and you lift your head up, you'll feel you activate just slightly your abdominals. And this is just working on the beginning activation of those muscles. So, we know that straight leg raise and lower trunk rotations are definitely too much. Lower trunk rotation activates the wrong muscle. Straight leg raise is just a lot of stress. So that puts us down to partial sit-ups or head lift. And then when we look at partial sit-ups, we know that still puts a bit more stress than a head lift does. And at this rate, this patient's starting out. Now, if they were like a 4, I'd do partial sit-ups. But since they're not even a 3, they're a 3 minus, I would stick with the head lift. And so that is the answer to this question. Thank you for your time, and have a good day.